All right, welcome back to Bayou Time. You've seen me so many times here on the news desk as we talk about Cardiovascular Institute of the South. And from those early interviews, we were just talking in 84 and 85 and how much they've grown over the years. And I got to say, we're going to talk about Dr. Matthew Finn. He has recently joined the staff of Cardiovascular Institute of the South. And just a little light moment, I was telling him about the interviews we did in 84, and he said that's when I was born. So, Dr. Finn, right off the bat, welcome. And now I feel really old now, but thank you. It's good to see you. No.
Thanks for having me.
Yeah, no doubt. Let me just inform the audience a little bit. Dr. Matthew Finn, and maybe get a shot at the doc as I go through his bio here, because it's all about him. Dr. Finn is an interventional cardiologist at Cardiovascular Institute of the South in Houma. He completed his bachelor's degree in biology at the University of Texas before attending Louisiana State University Health and Science Center School of Medicine in New Orleans. We're glad you made that move from Texas to LSU. That's always a good thing.
Good decision.
Around here. Doc completed a master's degree in patient-oriented research from Columbia University in New York, where he trained in cardiology, interventional cardiology, and vascular medicine fellow. At this location, he also served as an assistant professor of medicine and was named chief cardiology fellow. He completed his internal medicine internship and residency at Johns Hopkins Hospital in Baltimore, Maryland, where he was also named chief medical resident and served as an instructor of medicine. Dr. Finn is board certified in internal medicine, cardiology, and echocardiography. He was awarded the Physician PA Partner Award at New York Presbyterian Hospital and the Clinical Cardiology Fellows Award for outstanding service and fellowship at Columbia University. He is a member of the Society for Cardiovascular Angiography and Interventions and the American College of Cardiology. He has written for multiple publications, including peer-reviewed research publications, editorials, case reports, and more. Dr. Finn specializes in diagnosing and treating peripheral artery disease in the legs. Wow, what a resume. You're young, but you have covered a lot of ground. First of all, congratulations. Secondly, thank you for choosing this area. We appreciate it. So what got you interested in medicine? I mean, with that resume, obviously something was the trigger.
Well, I would say it's cliche to say this, but my primary driver for medicine is just helping people. That's my main goal. I love the one-on-one patient interactions, the relationships you get a chance to develop, and I'm excited to do that here back in my home state.
Yeah. From Destrehan.
That's right.
And I was joking a little bit. In my senior year at Vanderbilt, Destrehan was the only team that got past us, so they've always had good history of athletics and all. But good to see someone from Destrehan coming to Houma. And you've been able to see so many things abroad, but then you come to Houma and there's Dr. Walker and his dreams and all these other doctors that are doing some incredible work. It's got to be impressive for someone in the medicine field to come into Houma and see what's happening.
It's extremely impressive what's going on down here. The aggressive treatment, both treatment and prevention of both coronary and peripheral vascular disease and peripheral venous disease. And I'm extremely excited to have the opportunity to contribute to the health of Southern Louisiana.
Yeah, you know, the peripheral artery and the diseases, and I was telling you a little bit about May Thurner. I've talked to so many people that have gone in for May Thurner. We didn't even know what May Thurner was several years ago. Now everybody's getting iliac stents and they feel so much better. And a lot of people watching may be experiencing their legs feel like 50-pound bags of cement are tied to them. But there's so many things that before we didn't really know. And y'all are doing some incredible things and just getting that blood flow back up to the heart.
Yes, May Thurner classically has been very underdiagnosed. It's a venous disease caused by compression, classically compression from the iliac artery, where the artery and the vein cross each other, and it can be treated with ballooning or stenting. And there's a variety of complications that can occur from the disorder, but swelling, varicose veins are two of the more common ones.
Yeah. As you start off your career, and you're working with a guy like Dr. Walker, and I know you told me you were with him last week. It's got to be pretty enlightening to see somebody so well seasoned, so much into his career, and what he can offer to society, really.
Yeah, it's an incredible opportunity to get to work with his group and with him. I consider it a great privilege.
As I'm looking at your resume again, and we're looking at, I mean, these are some big facilities that you've really had a lot of training at. And then you come to Homa, so it automatically makes me think that Homa has a lot to offer when it comes to medicine. When you go through these facilities like John Hopkins and then when you went through all the other ones, very similar treatments, or does everybody sort of do their own thing, or are they pretty common?
Well, I would say that Homa's on the cutting edge of treatments, as are those other institutions where I've trained. Around the country, some care can be variable, but I'm proud to say here in Homa, we do offer cutting edge treatments, and I'm excited to help contribute to that with the team here.
You know, in y'all field, God, I was learning so much with the May-Thurner syndrome, and you're going in veins. And I don't want to compare it to a video game because it's not, but there's just a lot of little intricate work that you got to go in, and you're doing things in veins that before you had to open up, and some of them you couldn't. Some of them you just, most people didn't know what they had. And so it's got to be exciting for a younger generation physician to come in with all this technology that you have. You got to be beaming because you have that technology.
100% agree. The technology is a critical part of what we do, and understanding it, interpreting it, can be very challenging and very gratifying. So I am excited to be able to, translate that technology to current practice.
All right. Let's talk about PAD, pulmonary embolisms, because that seems to be an area that you're well versed in. How common is that?
So pulmonary embolism, believe it or not, is the third leading cause of cardiovascular death, behind coronary artery disease and heart failure being one, and two being stroke. So it's an extremely important condition. And recently, the community, the cardiology, vascular, and radiology communities have made great strides in treatment of pulmonary embolism, where additional therapies can be offered to help alleviate symptoms, reduce lengths of the hospitalization, improve outcomes.
Tell me a little bit more about that. What do people experience when they're going through this? And I'm sure maybe if they recognize what some of the symptoms are, maybe they can get help quicker.
Thank you. Yeah, so pulmonary embolism is a very serious condition where a blood clot, usually starting in the leg, travels to the lung, to the arteries in the lung, and can obstruct blood flow through the lung and prevent blood from moving to the left side of the heart. It can cause chest pain, severe shortness of breath, syncope, shock, or death. So aggressive treatment and early recognition are important. There are conditions called chronic thromboembolic pulmonary hypertension, where patients have these slowly develop over time, and they can develop high blood pressure in the lungs from them, which is a little bit different than an acute process where the blood clot suddenly travels to the lung.
You said syncope.
Yes.
What is that exactly?
That's fainting or passing out.
All right. So dizziness, is that syncope?
Dizziness can be a component of it. This is a more extreme version of it where someone could pass out.
Okay. So all these things directly in the realm of an interventional cardiologist, what other arenas do y'all handle?
Well, one exciting thing about pulmonary embolism treatment is the team philosophy. So we work closely with our physicians and surgery and in radiology, as well as pulmonary critical care to help manage these patients when they're extremely sick. So it's a very team-based approach to managing the patient, which is an exciting thing to be a part of.
And the thing I've been so impressed by in covering a lot of these stories with Dr. Walker, Dr. Feo, and I can go down the line, is the fact that people before who were getting amputated, or I see them around town, they're walking, some of them are doing light jogging, they're doing different things. This is incredible. That's got to make you, it's got to be worth your whole reason for going to all that school and just watching people rebound from something that before they would lose a limb.
Oh, that's incredibly gratifying. And you know, like I said at the beginning, the reason I went into medicine is to help people, and help saving limbs is a critical piece of what we're trying to do here at Cardiovascular Institute of the South.
Yeah. And I got to say, we're glad to have you, because your credentials are unbelievable. When I was reading them off, it's just, it's always good. And it seems like Dr. Walker and his staff, and they do such a great job at finding the cream of the crop. And Dr. Finn is certainly one of those that I'm sure a lot of people were in high demand for. But we have you in Houma, Louisiana now. It's good to have you here, and we look forward to having you on. And I'm sure he'll be on the cutting edge, just like Dr. Walker was and all his staff all these years. So we'll have you on anytime you want to come on, and good luck in your practice, and we look forward to seeing you a lot more.
Thank you so much. Thank
Not
you.
in the clinic, though. We'll see you on the interview.
That's right.
All right. There you have it. Dr. Matt Flynn. We appreciate him being here. By the way, do you go by Matthew, or is it Matt?
Matthew.
Matthew, okay. Yeah, because Matt Flynn used to be a quarterback at LSU.
Yeah.
So it's Matthew Flynn. All right. We'll take a short break. We'll be back. Don't go away.